have things you got to get to, and I also know we got a few other people who are going to be coming in later, as boys basketball is just wrapping up at 6 o'clock. So if there are some chairs available, a few more kids are going to be coming in here probably in the next 5 minutes or so. Are there going to be a few more?
There's more chairs.
Okay, so just so I know where to send them. Thank you all so much for coming out tonight. These wonderful ladies presented last year, and from my club members last year, they asked for them to return. So you got the vote to come back, do it again. And on top of that, I know around here at school, we have a crisis on our hand, and it's vaping. And you kids may think, even adults may think, it's all safe. They're going to tell us it's not. They're working at OSF right now in the oncology department. That's cancer. And of course, cancer is that word we all are trying to avoid. And I think they have some wonderful information, not only just about being nurses, but what it's like to face that life and death situation in their job as the oncology nurses. And then they have the pig lungs and demonstrating to you guys what exactly is going on when we're taking things into our lungs and why does it lead to cancer. So I cannot thank you guys enough. Megan and Catherine and Miss Leah. Go for it. Sydney's mom. Where's Sydney at? So, because Megan is actually going to become a teacher at ISU for the nursing program in the next couple weeks. Yep. So that's what happens is you start off as RN. Yep. The progression you can make is choosing nursing as your career. There's just so many career opportunities. So, ladies, thank you so very much. I'll turn things over to you and let me know anything at all that I need to help you out with. So thank you very much.
Thanks for coming out on like a school night. That's pretty awesome. So I heard you guys are getting some extra credit, which is really wonderful. So I'm Megan Rathlier. I am a lung cancer navigator. So we specialize in lung cancer patients. I will have my master's in 2 weeks in nursing. I'm oncology certified and I'm also a cancer survivor. So we're going to talk to you a little bit about a few different things today. I'm going to start you off by talking about cancer in general. We're going to talk about oncology nursing, and then we'll go into lung cancer specific, and then do some stuff on vaping. So you get like a little taste of everything today. Okay, cool. So I'm going to start us off with an activity. I know everyone cringes, but it'll be okay, I promise. I need all of the ladies to please number off 1 through 3.
1,
2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2. 1, 2.
Where's our next one? 3.
1. 1, 2.
3. Where's my 3? Perfect.
She won.
She's 1, 2, 3, 4.
We're almost there, you guys. Beautiful. Did we make it? All the ladies counted? You have it? Okay. Gentlemen, I need you to follow suit, but you're going to number off 1 and 2. Okay.
1.
Focus. We can't not focus.
2. 1. 2.
Where are we?
I think
Gentlemen,
What happened?
what happened, guys?
I think we were.
I'll be a 1.
Okay, 1.
2.
Perfect.
3.
No, you're two.
No, wait, what? Oh, we're doing 2s?
So we got one, okay, one back there. Let's jump up to this front row. So Mr. Worley, you'll be a 2. 1. Okay, jump back in the back row then. Anybody else?
Are we good? Do we have it?
Let's do, you be
All
a
the
2.
gentlemen, do you have a
Pop in
number?
your 1, 2. Right, 1, 2. I think pretty
Okay,
close.
are we good? Okay. I need all of the ones to please stand.
I'm a 1.
Do I have you guys? I want you to look around the room because statistically, this is how many people will have cancer in their lifetime. It's 1 in 2 men and it's 1 in 3 women.
I knew it.
So this is why this stuff is so important. And if you guys want to go into medicine of any kind, I hope that you would strongly consider oncology because unfortunately it's a growing field. Okay, and it's definitely here to stay. So we're going to teach you some Latin so that when you watch House and Grey's Anatomy and all those other shows that you feel super smart. What is What does onc mean? Anybody know? Anybody in the medical class know this? Onco? Cancer. Exactly. What does ology mean? Wow, good job. Very good. So onco, again, cancer. What is genesis mean?
Origin.
The start of.
Wait, we have candy.
Yeah, we do have candy.
Oh, I answered.
Throw it out.
Have a king. I said origin.
So when we talk about oncogenesis or the start of cancer, does anybody know what cancer is? Can anyone define it for us? Oh, that guy shot right up. What's that? Beautiful. Anybody can explain that in non-Latin terms? Yeah. Exactly. Uncontrolled cell division. Exactly. Beautifully done. So, inside of our cells, we have different pathways that have brakes to the cell, and they also have accelerator pedals to the cell. Our cells are really good at regulating themselves. If they're too damaged, they destroy themselves. Okay, it's called apoptosis. So what happens with cancer is because they have become so damaged, they lose this ability to control themselves. The brakes are cut, the accelerator pedal is pressed to the floor. It grows uncontrollably, it consumes its own resources, then invades the personal space of others, consumes their resources, and then spreads. Okay, that is what makes cancer so dangerous and so different than normal cell functioning. These are hot terms in cancer, grade and stage. They're different from each other. Okay, grade means how fast is this cancer. So how badly damaged is it? How badly damaged is it, and how fast can it spread? Okay, so this is kind of like how fast is the cancer. Stage. Does anybody know what stage is? Anybody heard of this? Stage 1 through 4. Purple sweater.
Like how far it's going.
Exactly, how sparse. So how contained is my cancer versus how far spread it is. Most solid tumor cancers are stage 1 through 4, okay? 1 being the most contained, 4 being the most far spread, okay? The stage of the cancer will determine what treatment we use. So in early stage cancer, a stage 1, we might be able to do surgery on it to remove it. A stage 4, when it's spread throughout the body, we need to use treatments that go through the whole body to help treat it. Okay, so doctors and care teams use staging to help determine what the most appropriate treatment is for that cancer. When we go to stage, solid tumor cancers, and I say that because we have blood cancers, right? Those are staged differently. Solid tumor cancers, we look at 3 things: the T, the N, and the M. T stands for tumor. When I'm looking at my tumor, I want to know how big is the tumor, how many of them are there, and where are they? Okay. Are they pressing up against any dangerous structures? Is this tumor in my lung invading into my heart? Are there 3 of them, or are they 1 and it's super small? That area gets assigned a number. Okay, does that make sense? N, I don't know why it's not L, but N stands for lymph nodes. Okay, it's like parentheses L, lymph nodes. Does anybody know what the lymphatic system does in the body?
Fights off any like unwanted bacteria.
Fabulous. They house our immune system. What else do they do? Super important. Yes. Exactly. They're like a filter. Excellent. What else? Something that is less known to the general population but is incredibly important for cancer. Anybody else have any ideas what else the lymphatic system does? This is like worth 2 pieces of candy.
Yeah.
Anybody? Any ideas? It's okay to be wrong. Yeah.
Produce white blood cells.
They don't produce it, but they house and mature them. Great point. So I'll let you know, they're kind of like the drainage system, right? So they take any extra fluid in our body that's not where it should be and push it back into the circulatory system where it belongs, okay? Does that make sense? Without our lymphatic system would be really swollen. Does that make sense? Okay. So it really helps control swelling. So the reason we care about this lymph nodes, this is an example of lymph nodes, these little pockets in here. They're all over our body. And so because they drain fluid from things, theoretically, they should be the first part of our body that might get exposed to cancer as it's trying to spread. Why? Because those lymph nodes are draining fluid off of that tumor. Does that make sense? And as cells break away, they may travel to the lymph nodes first before they spread to the rest of the body. So our doctors and our providers and our nurses really care if there are any lymph nodes involved when we go to stage 1. Okay. M stands for metastasis. Does anybody know what metastasis is? Perfect. Spread. Metastasis is spread. So we assign a number to the T stage, the N stage, and the M stage, and then they use those 3 numbers to create the patient's final stage. Does that make sense? So those are the things that we look at when we go to stage cancer. So now you have a very brief introduction to cancer. I'll talk about oncology nursing. I love being a nurse. I love being a nurse. I love being an oncology nurse. So for nurses, we are the final, we are kind of that final catch, the final net between a mistake and a medical error in our patient. We're charged with their safety. We're there when the doctors aren't. The doctor's usually around on the floor for a few minutes, and we're there the rest of the 12 hours. So nurses have to be incredibly smart. They have to be able to think on their feet. They have to have really good assessment skills. They also have to have really good emotional intelligence, which is the ability to reflect on yourself and be able to read other people and connect with them, okay? Because we're there with people who are suffering quite a bit. So before I did this job, I worked over inpatient, where we took care of cancer patients who were sick enough to be in the hospital. Those patients are incredibly sick and very vulnerable. You have to be able to recognize, prevent, and deal with emergencies as soon as they come up. But then you also have to be able to create really wonderful, lasting relationships with these patients too, because they're a guest on your unit sometimes for 60 days. Some of our patients with leukemia would have to be there for a really long time. So, there's a lot of things that you can do with nursing. There's a lot of things you can do with oncology nursing. You can work in the hospital. You can work in treatment centers. You could be a navigator like we are. As navigators, we're kind of that nucleus for the patient. We help get them through treatment, and we're a support person and an education source for them too. You can get national certifications, which designate you as an expert in your field. You can publish. Catherine and I are working on research right now that we're hoping to get presented at national conferences and published. So it's pretty cool. And so just a plug, and also a plug to Mennonite College of Nursing at ISU. In 2 weeks, I will have my master's, and in 2 weeks, I'm going to start my next journey as a college professor. So I hope to see you guys out there. So I'm going to turn this over to Catherine, and she's going to talk to you a little bit about lung cancer specifically.
Okay.
And the pig.
We're going to take what Megan just said and kind of put it into action here and get a little understanding of lung cancer. But first, how many in here are part of the Medical Careers Club? Oh, quite a few. Awesome. Good job, guys, on your nerdiness. That's fabulous. Great job. Great career. No matter what field you're going into, not just nursing, but doctor, pharmacist, CNA, anything. It's a great job. Can you guys in the back hear me okay? Do I need to talk up? Okay. Awesome. So Megan is a teacher. I am not a teacher, I'm a nurse. So I have to have notes. So I apologize for that. But I'm going to tell you a little bit about lung cancer. So first, what Megan had to say was kind of heavy and a lot of information. So everybody kind of take a good deep breath, big breath in and let it out. Relax a little. Okay. I needed that. But actually, I wanted to use that to talk a little bit about the lungs and what just happened inside of your lungs. So this is a set of lungs. We have the trachea, so when you breathe in, what's happening is actually your diaphragm is contracting and expanding down, which pulls your lungs down and allows air to come in. And then when you breathe out, your diaphragm is relaxing, which pushes your lungs back up and pushes the air out of your lungs. So you have your trachea right here, which is where the air comes in, and it branches off into two tubes right here called your bronchus. And then those enter into the lungs. On the left side, you only have 2 lobes, and on the right side, you have 3 lobes of your lung. And inside those lobes, or inside the lungs, are these little sacs called alveoli, and that's where the air goes and gets filtered into your blood. Those alveoli are going to pull in that oxygen, take the oxygen and put it into your bloodstream, and then when you breathe out, you're breathing out all the carbon dioxide and all the extra stuff your body doesn't need. And then Megan gave you a little spoiler, but these little green things are called your lymph nodes. You have them all over the place, not just where they're in here on the picture, but they're actually out in your lungs. They're up in your chest up here, up in your neck. They're through your whole body. That's important in lung cancer because that's going to help us stage cancer. Does anyone know what the risk factors of lung cancer are? Can anyone name any of them? Yeah. Vaping? What else? I saw some other hands. Who else has something else? Yeah. Smoking. Smoking. Spot on. That's the #1 risk factor for lung cancer. Yeah. Family history. Absolutely. That's a big one too. Yeah.
Age?
Age. That's awesome. Good job. That's one a lot of people don't think about. Yeah. Toxins in air. Toxins in the air. Actually, the #2 after smoking, and that smoking does not necessarily include vaping. The #2 is called radon gas. Has anyone heard of radon gas? Yeah. So that's just an invisible gas that rises up out of the ground. You can't smell it. You can't taste it. You don't know it's there. It likes to hang out in your basement. And it's really important that you get your house tested for radon gas because it is the #2 cause of lung cancer. Anything else anyone can think of? I think we pretty much covered the top ones there. Okay, so let's talk a little bit about lung cancer. So we're going to start, I'm just going to use a case study. So we're going to talk about a girl. I made her up, but she's very much based on a lot of my patients and what I see on a regular basis. So I'm going to introduce you to Mary. Mary is a 65-year-old smoker. She has smoked 2 packs a day for 30 years. Okay, now in lung cancer world, we have something called, when we look at how much you smoked, the medical community calculates that and says you have a pack year history. So a pack year history means I smoked this many packs a day for this many years. Multiply them together, you have your pack year history. So if she smoked 2 packs a day for 30 years, what's her pack year history? 60, yay, good job. Everybody gets that. For basic math. So you have a 60-pack year history, okay? Now Mary, in January of this year, started getting fevers, started having a bad cough, was coughing up gunk, feeling terrible. She went to her PCP. Her PCP did a chest x-ray and saw some spots in her lungs and said, oh, looks like you have pneumonia. I'm going to give you this antibiotic, take a 7-day course of antibiotic, go home and get better, and we're fine. So Mary did that. She goes home, she takes her antibiotic, everything seems okay, right? Only as soon as she comes off that antibiotic, she still feels terrible. She's not getting any better. So she goes back to her PCP a month later. Okay, it's February now. She says, Doc, I don't feel any better. I took your antibiotic. Still feel terrible. What do I do? So he's like, oh, well, we must have given you the wrong antibiotic for your pneumonia. Here's a different antibiotic. Try this one out. She goes home. She takes that antibiotic, thinks she's doing better, comes off of it. She goes right back downhill, starts her fevers again, her cough. She feels terrible. She's so sick. What do we do? So goes back to her PCP. Now it's March, okay? It's 3 months after she first started feeling sick. She goes back and the doctor says, all right, this is kind of strange. Let's get a chest CT, okay? Chest CT is a lot more specific than a x-ray, all right? An x-ray will show you little spots, little dark spots and stuff like that in your lungs. A chest CT looks at your lungs in slices. So they're gonna slice your lung, very thin little slices, so they can get a good view of your lung and exactly what's going on in it. And it's able to say, oh my goodness, Mary has a 2-centimeter mass sitting in her lungs, okay? Right here where the bronchus comes in. We call that the hilar area, where these tubes filter into your lungs. She's got a mass in there. And that's what's causing her cough and her fevers. So we need to figure out what that mass is. It could be a lot of different things. There's a lot of things that cause masses in your lungs, not just cancer. But the doctor says, oh, we need to find out what's going on there and why you keep having pneumonia. So he says, all right, we're going to go get a biopsy. All right? So Mary gets a biopsy. What they do is we do something called a bronchoscopy. A bronchoscopy is when they send a tube down your throat. It's a lighted tube with a camera on the end. And then they have an ultrasound, which they use outside to see where that tube goes. They send that tube down here into your lung, and they're able to put a needle through into your lung and get samples of that mass, okay? Biopsy comes back and she's got something called squamous cell carcinoma, all right? Squamous cell carcinoma is a non-small cell lung cancer. In the world of lung cancer, there's 2 main categories of lung cancer. There's small cell and non-small cell, all right? Small cell is the aggressive kind, very known to be among smokers. You'll hardly ever find a small cell that wasn't a smoker. Non-small cell is found in smokers and non-smokers, okay? It's still aggressive, it still can be aggressive, it's not quite as aggressive as the small cell, okay? So the squamous cell is the second most common kind of non-small cell lung cancer, okay? The squamous cell, we often see those here in the inside of the lungs towards where the bronchus comes in. All right, so now we have a diagnosis. We know Mary's got lung cancer, okay, but we still need a lot more information. We don't know anything other than the fact that this tumor is about 2 centimeters, okay? In the medical world, we're weird. We measure everything in centimeters. We don't do the inches then. So we know we have this, but we don't know if it's anywhere outside the lungs. We don't know if any of these lymph nodes are involved or not. So we can't stage her. And without being able to stage Mary, we don't know how to treat her, okay? So what we do is we get a test called a PET scan. All right, and a PET scan is gonna look at Mary from the neck to the knees. It's very cancer specific, okay? So cancer cells, like Megan said, they're growing out of control, okay? They're on fast forward mode. And they eat sugar really quickly. So we're gonna give Mary an injection of sugar that has a radio tracer in it, okay? It's a radioactive sugar. We're gonna stick that in her and then we're gonna stick her under this PET scanner and it's gonna read anything that's eating sugar really fast, all right? Cancer eats sugar really fast. So it's gonna light up on this PET scan. lights up in like a red to a yellow to a white color, depending on how fast it's going. And that's going to tell us our grade. Oops. That's going to tell us our grade is what color it lights up. Oh, thank you, Megan. Look at this. Yeah, here's your PET scan. So your brain is super metabolically active, so it's always going to light up on a PET scan. But you can see all these spots lighting up. Now, a PET scan, your bladder and your heart are also very, very active, so they're always going to light up too. But you can see all these spots lighting up in these people that we're going to be concerned about. Now, there are other things that eat sugar quickly, so the PET scan's not 100%. Definitely this is cancer that lights up. But you can see, look how bright that is. Look, that looks just like Mary. So that is going to tell us, oh, that looks like cancer. Now, in Mary's case, what that PET scan shows us is that she's got a 2-centimeter mass, and then she's got some lymph nodes that have lit up, okay? But there's nothing outside of her lungs. Now, I will say, cancer likes to go to the, or lung cancer in particular, likes to spread to the brain, likes to spread to the bone, and likes to spread to the adrenal glands, which sit right above your kidneys, okay? In Mary's case, she doesn't have anything outside the lungs. She's just got that mass and some lymph nodes lighting up, okay? This is what brain cancer looks like on brain mets. Since the PET scan can't read your brain, we have to get a brain MRI on top of that just to check and see that it hasn't spread to the brain. So now we know Mary has lung cancer, a squamous cell cancer, and we know she's got a 2-centimeter mass and some of her lymph nodes lit up. Okay, so that's when we're going to bring in this scale right here, tumor node mets. So tumor is 2 centimeters. 2 centimeters are actually fairly small in the lung cancer world, so that's a T1. Nodes depends on where the nodes are. So Mary's nodes are going to be located right here. It's called the subcarinal. Okay, this spot where the bronchus branches, that's called the carina. And these little nodes right there are called subcarinal nodes, and those are N2 because of where they're located. Okay, so we've got a T1, N2, shouldn't have any mets, so N0 lung cancer. Okay, that's going to be a stage 3 lung cancer that Mary has. So what do we do with that? Now that we know that, we're going to send her to treatment. Okay, treatment for a stage 3 lung cancer is going to be chemotherapy and radiation together. And the two of those are going to work together to kill off her lung cancer. At a stage 3, we still hope that we can offer Mary a cure. Stage 1, we are pretty sure we can cure you at a stage 1. Stage 2, still a good chance of cure. Stage 3, we're going to try. Stage 4, we don't offer a cure at stage 4. Okay. So that's lung cancer in a nutshell. What am I missing here? I think we kind of covered everything. Oh, except one other thing I want to say. So lung cancer, why is it a big deal? Okay. So lung cancer, just a few statistics for you. In the United States, there's about 2,300 diagnoses of lung cancer every year. To put that into perspective, the Vietnam War, the United States was in the Vietnam War for 8 years. We lost about 50,000 people in the Vietnam War, okay, in 8 years. So lung cancer, in 1 year, kills 3 times the number of people that died in the whole Vietnam War, okay? Excuse me, I'm sorry. I said that wrong. So 2,300 diagnoses, 1,500 deaths in a year. Okay, so that's the 3 times the Vietnam War. Also,